Hello, and welcome to Virginia Medicaid Waivers, a presentation by the ARC of Virginia. This presentation will largely focus on the Commonwealth Coordinated Care Plus waiver. The ARC of Virginia is a state chapter of the ARC of the United States, the nation's oldest and largest organization of and for people with intellectual and developmental disabilities and their families. The ARC's mission is to promote and protect the human rights of people with or at risk of developmental disabilities and actively support their full inclusion and participation in the community throughout their lifetime. In this presentation, we will look at Medicaid health insurance, Medicaid waivers, the CCC Plus waiver services, eligibility, application process, and what to do when you have a CCC Plus waiver. First, let's look at the terms Medicaid and waiver separately to understand what they mean. Medicaid is the insurance that pays for waiver services. Waiver means that the requirement that Medicaid services be provided to all in the state is not required. Instead, the services in the waiver are only for select populations. Put together, a Medicaid waiver provides the insurance that pays for the services that are only available to a select defined population. When a person has a Medicaid waiver, they have health insurance and access to the waiver services. Home and community-based care waivers. Waivers give the states the flexibility to develop and implement alternatives to institutions, such as a nursing facility or a hospital-like environment to get needed services. Let's look at the what and why of Medicaid waivers. A waiver is a long-term support system for people of any age with long-term care needs. Many people with developmental disabilities have long-term care needs. A waiver offers a menu of services and supports for people to live in the community versus a nursing home or a hospital-like environment. There are numerous services and waivers, including personal care, respite, employment and day services, residential, skill building services, nursing, and much more depending on the type of waiver. One thing that's really important to realize is that waivers are the only public funding source for long-term developmental disability supports. So many people are used to getting their services that they need through the school system. However, once you leave the school system, there is no longer an entitlement program that will provide services unless you have the only publicly funded Medicaid waivers. Medicaid is overseen by the state and federal government. Virginia's state Medicaid agency is the Department of Medical Assistance Services, or DMAS. The federal agency is the Centers for Medicare and Medicaid Services, or CMS. Both of these agencies have financial and regulatory roles. You may be wondering, who pays for Medicaid waivers? That comes from state and federal dollars. The federal government mandates that states with Medicaid and all states do have Medicaid programs, that they provide certain services that you see listed on the slide, including EPSDT, health clinics, family planning, home health services, hospital services, lab and x-ray, Medicare premiums, nurse midwife, nurse practitioner, nursing facilities, physician services, and transportation. EPSDT, that stands for Early Periodic Screening, Diagnosis, and Treatment. This is Medicaid's comprehensive and preventive healthcare services for children from the time of birth up until their 21st birthday. EPSDT has specialized medical services that are medically necessary for children that are not routinely covered through Virginia Medicaid. Once they turn 21, they are no longer eligible for EPSDT. So on this slide, you see some of the EPSDT services. This is not all of them, but it includes your typical child check, when you go to the pediatrician, developmental exams, immunizations, and then specialized things such as audiology and hearing aids, private duty nursing, personal care, assistive technology, medical infant formula and supplements, behavior therapy, and residential behavior therapy. On the slide, you'll see the link on the DMAS website where you can find much more information. You can also call or email, and those numbers and addresses are on the slide. States may also choose to provide optional services. Virginia has chosen to provide these optional services: case management, home and community-based waivers, hospice, intermediate care facilities, mental health, psychology, optometry, physical, occupational, and speech therapies, podiatry, prescribed drugs, prosthetics, and home health. What is noteworthy here especially is that waivers are optional. States are not required to provide waivers. It does so happen that every state in the United States does have some sort of waiver programs, but your waiver in Virginia will not transfer if you move to another state. Adults with Medicaid waivers may have to pay for some waiver services if they have income over $1,292 per month. This is called patient pay. It's paid each month, and there are some exceptions for people who are working. Once a person has a waiver, then they must apply for Medicaid if they don't already have it. They will have a Medicaid card. They will have a Medicaid health insurance. They are eligible for all the services in the waiver. Most people will be enrolled in a managed care program. CCC Plus stands for Commonwealth Coordinated Care Plus. These are two separate things that have the same name, CCC Plus. And the two separate things are CCC Plus Managed Health Care and the CCC Plus Waiver Services. This can get very confusing at times. HIP, or the Health Insurance Premium Payment Program, is a Medicaid program. It's for Medicaid members who also have employer-based health insurance. The employee may be eligible for the HIP program. HIP may pay a portion or the total insurance premium for qualifying plans by reimbursing the employee. An application separate from the Medicaid application is submitted to the Virginia Department of Medical Services. So for more information, you can go to the link provided. An example of this would be when a person has a waiver, they're on perhaps their parents' private health insurance program. So they have two insurance coverages. So if they stay on their parents' private health insurance plan, if their parents' plan qualifies for the HIP program, and let's say $600 a month comes out of the employee's paycheck, then that entire $600 could be reimbursed to that parent every month. And in that case, their primary insurance is their private insurance through their parent is primary, and then Medicaid is secondary. There are two Medicaid waiver programs that are especially used by people with disabilities: the Developmental Disability Waiver, or DD waiver. And that waiver program has three subtypes of waivers: the Community Living Waiver, Family and Individual Supports Waiver, and the Building Independence Waiver. The Commonwealth Coordinated Care Plus waiver does not have subtypes of waivers, and it was formerly the EDCD and the TEC waivers that were combined in 2017 and are now the CCC Plus waiver. Let's compare these two waiver programs. You must have a developmental disability diagnosis or be at risk of a developmental diagnosis to be eligible for the DD waiver. In the DD waiver, there's a comprehensive menu of 32 services for home, community, medical, work, skill building, and much more. Up to 24/7 support is available. It has a large needs-based waiting list, and it's operated by the local community services board. Now let's look at the CCC Plus waiver. You must have a disability diagnosis, note, I didn't say developmental, and a medical need. There are fewer services in this waiver. There's about 9 services, more focused on home care, nursing. You can be in the community, but it doesn't have any work-related or residential supports or skill building. It does not have support 24/7. There is no waiting list, and it's operated by local health and social services departments. To be eligible for either waiver, there are 3 criteria that a person must meet. They are diagnostic, functional, and financial criteria. The financial criteria is the same for both the DD and the CCC plus waivers. First of all, parent income never counts. Many people think that for Medicaid waivers, the parent or family income is considered. That is not true. There's no resource limit for children. A child could have millions of dollars. However, once they turn 18, or when any person turns 18, then there is a monthly income limit of $2,349 per month, and there's a resource limit of $2,000. Let's take a look at the CCC Plus Medicaid waiver services. The services in the CCC Plus waiver are adult day health care, personal assistance services, private duty nursing, respite care services, facilitation, assistive technology, environmental modifications, personal emergency response system, and transition services. For personal and attendant care, a child or adult receives assistance from an attendant to help them with everyday activities such as dressing, bathing, eating, mobility, being in the community, toileting, and supervision. Some waiver services may be delivered through the consumer-directed model. In the consumer-directed model, the child or adult with the waiver recruits, hires, fires, trains, supervises the attendants. And so, of course, for a child, usually a parent is serving as the person in that role. In the agency model, attendants are provided by an agency who handles all of those functions, the hiring, firing, recruiting, supervising, etc. And personal attendant care services may be provided in any environment. The rule for this service is that parents of minor children and spouses of those with waivers were not allowed to be paid as care attendants. Parents of children 18 and over may be paid as attendants. However, due to COVID-19, parents of minors and spouses of people with a waiver may be paid as attendants. As of now, this flexibility is in effect until January 26, 2021. There are 3 services that are related to services facilitation. Personal care, respite, and companion are consumer-directed services. Companion is only available in the DD waiver. Services facilitation is a service that the majority of people who use consumer-directed use this service. Services facilitation organizations are tasked with training the employer of record. The employer of record, or EOR, is usually a parent or family member who has responsibility for that recruitment, hiring, training, firing, supervising, and approval of time worked of the attendants. The services facilitator can troubleshoot. The services facilitator monitors and assesses the service provided in person or virtually, as it is maybe done now. They do that the first 30 days of the service, 60 days, 90 days, and thereafter every 90 days. Very few people take on the task of services facilitation by themselves. Something very important to keep in mind is that services facilitators are not the go-to person for other waiver matters. While some services facilitations organizations have a lot of information about waivers and they want to be helpful, but you should not expect or ask them to help with other services or matters related to waivers. Assistive technology is one of the CCC Plus services, and it pays for technology that assists the child or adult to be more independent in activities of daily living, such as bathing, eating, communication. Devices are usually portable and may include specialized medical equipment, communications, devices, controls. To use this service, there is a process. You must have a prescription for an AT evaluation that comes from a doctor. You have to have the evaluation done by a qualified Medicaid professional. There must be a quote by a Medicaid assistive technology provider. Delivery is after authorization. This service has a limit once a person turns 21. People over the age of 21 have a limited amount of assistive technology available to them annually. There's a $5,000 limit. However, that limit does not apply to people who are under the age of 21. The AT requirements include that the item is for a medical person. It has to be recommended by a qualified professional. Medical documentation must provide DMAS with a clear understanding of the person's needs. There is extensive information on the DMAS link above that addresses the requirements for assistive technology. Environmental modifications are physical adaptations to the home, vehicle, or work site that enable the person to function with greater independence, ensure safety and welfare of the individual. So modifications might be made to a primary home, such as ramps, accessible rooms, security features. On a vehicle, it could be lifts, ramps, hand controls. This is limited to $5,000 per calendar year. Private duty nursing is continuous care up to 16 hours a day, and it's only available through the waiver if it's not already covered through the person's private health insurance. There's very specific medical criteria to be eligible for this. Usually the person must be using some sort of highly specialized medical or technological support. An example would be a person who's using a ventilator. Respite gives the parent or the primary caregiver a break from caring for the person with the waiver. It also gives the person with the waiver a break from their parent or primary caregiver. Up to 480 hours a year of respite are available. This is a consumer-directed and an agency-directed service, and you may be using both at the same time. You may be the EOR who's hiring attendants, and you could be using an agency service at the same time also. Adult day healthcare usually takes place in a group setting. People usually come together, they engage in social and recreational activities. It's typically used by people who are elderly or cannot be left alone. Transitional services are for people transitioning from a nursing facility to a community home. Up to $5,000 is available for expenses to make that transition take place. Personal Emergency Response System, called PERS, think Life Alert, or it could be a medical management system, such as an electronic system that reminds people to take their medicine. To be eligible for this, the person must not be able to use a phone in an emergency. They must be 14 years or older. They must be left alone for a portion of the day, and they must have the cognitive ability to use the device. Let's look at the eligibility requirements now for the CCC Plus waiver. People with a disability of any age or people over 65 years are eligible for this waiver. They must have a disability. However, mental illness does not qualify as a disability diagnosis. The person may have mental illness, but they must have some other disability if they're under the age of 65. The person must meet the criteria for a nursing facility, and they must have a medical or nursing need. The Uniform Assessment Instrument, or UAI, is the tool used to determine if a person meets the criteria for this waiver. The UAI assesses a person's social, physical, and functional abilities. The screening is completed by a nurse from the health department, or if the person is in the hospital staff does the screening. There's also an additional tool, additional to the UAI, that's especially focused on children. And if you go to that link there, you'll find that tool for children. In fact, you'll find all of the forms that we refer to through this. So to apply for the CCC Plus waiver, you contact your local Department of Social Services or your local health department. Different localities have different starting points to get a screening. The screening may be done in a person's home, or it may be done virtually now during COVID. When you call to request the screening, be prepared to answer a few questions. Be prepared to identify your child's disabilities, your child's physical or health diagnoses, the CCC Plus waiver services that are needed. The last thing you want to say is that you want Medicaid to pay for therapies. That's not what waivers are for. Waivers are to provide services. You do not have to have Medicaid to be screened for a waiver. So how do you know if you're approved for a waiver or if your family member is? You will receive a letter of approval or denial from the local health department. At that point, if the person does not already have Medicaid health insurance, then immediately apply for Medicaid through your local Department of Social Services or online. When you apply, be sure to indicate that this is for a person who's been approved for a CCC Plus waiver, or it could be for a DD waiver also. If you're going to use consumer-directed services, that would be personal care or respite, then contact a services facilitation organization to get that process started. For agency-directed, be in contact with your care coordinator and contact agencies who might be available to provide the service you're looking for. When you fill out a Medicaid application and you're filling it out for a person under the age of 18, actually for any age, the application applies to the person who is going to have the waiver. So you don't put any information down about the parent's income. That's something that many people make a mistake about. And you need to indicate on the application everywhere you can that this is for a CCC Plus or DD waiver applicant. So for every question, it's does your child, et cetera, et cetera. Does your child have any income? Most people are going to say no. Most people in the CCC Plus waiver program will also be in the CCC Plus health plan. There are some populations that are excluded from this. People on HIP are not in the CCC Plus managed care program. Some of the basics of managed care are that the Department of Medical Assistance Services contracts with the managed care company that the person is enrolled in and pays the managed care organization a certain amount per month per member. The MCO contracts with the providers of the person's services and pays for those services. The providers in turn provide the care, the services for the person, and bill the MCO for the services that they provided. Commonwealth Coordinated Care Plus health plan includes many people with disabilities, but not all. And if you're enrolled in the CCC Plus managed care program, Your CCC Plus waiver services will be administered by your CCC Plus health plan managed care program. So when you're in a managed care program, your services are to be person-centered, individualized to your support plan. You have all the same standard Medicaid services. You have a choice of health plans. What is rather unique is that you have a care coordinator through the health plan that you select. They are to coordinate your health care professionals. They can provide assistance to other community resources such as housing and food. And each managed care company usually has additional benefits. There are 6 plans contracted across the state: Aetna, Anthem, Magellan, Optima, United Healthcare, Virginia Premier Health Plan. And on the link there, you can find the details about each of these plans. The CCC Plus Care Advocate Program is available to provide information to help with issues or questions or information that you may have or need about understanding your rights and benefits, including the CCC Plus waiver services and the health insurance portion. If you have an adverse action and you want to appeal it, you may want to work with the Care Advocate Program first for assistance. You have the right to appeal any Medicaid actions or decisions that you disagree with. However, the appeal must be requested within 30 days of the decision or action. The decision will be issued by a hearing officer, usually within 90 days. However, if you're enrolled in a CCC Plus managed care organization, you must first appeal through the managed care organization and their appeal process. And then if you're still not satisfied, you may appeal directly to DMAS. And just remember, you may want to contact the Care Advocate Program first for help. Something new that has just happened is that DMAS is now providing PPE for employers of record who want to order it. This will be available until December 30th, 2020. So if you are an EOR and want to order some PPE, you go to that link that you see on the slide to order PPE. Due to COVID-19, the Virginia Department of Medical Assistance Services have made numerous changes to what is allowed in the Medicaid system, including waivers. Some of these flexibilities include that parents of minor children and spouses of people using waiver personal care may be paid attendance until January 26, 2021. Face-to-face requirements for screenings, assessments, planning meetings are not required and may be done virtually. To keep up with these Medicaid flexibilities and changes, the ARC of Virginia has a coronavirus website where we have an FAQ for individuals and families using waivers, and we update that as changes occur. When you have questions about CCC Plus, there is an email address right there on the screen, cccpluswaiver@dmas.virginia.gov, where you can send your questions in to DMAS. Who are your helpers? First, if you're in managed care, you have that care coordinator. You may have a representative at the CSB if you are on the DD waiver wait list. If you have a case manager support coordinator at the CSB, but many people do not have a CSB case manager, those would all be people that you may contact. Help. You may need more information, you may be overloaded, so the ARC of Virginia is here. We have a website with all of the information we've just gone through on it. If you need help getting started or through your waiver process, we provide waiver mentoring, information, and referral. You can always call 649-8481, extension 104. That's area code 804. Our email is info, I-N-F-O, @thearcofva.org. And we also have this presentation and other presentations on our YouTube channel. If you are on the DD waiver wait list, we have a presentation called What to Do While You Wait. And the answer is to be active. I would encourage anyone who's on the DD waiver wait list to look at this presentation. So today is October 15th when we're doing this recording, and there's hot news that is coming out. The PPE information came out about 10 days ago. Today, the governor just announced that home health care workers will be provided $1,500 as hazard pay. We're also now going to have a Medicaid adult dental benefit. And there will be more to come as Virginia's budget from the 2020 special session of the Virginia General Assembly becomes finalized in the next few days by the governor. So please stay in touch with the ARC of Virginia and give us your feedback. We've told you about our website. We have email, phone, Facebook, and Twitter. So I hope this has been helpful for you. And we welcome your questions and any assistance that we might be able to provide.